Welcome to another edition of the Dementia Care Partner Talk Show. Now, here's dementia care expert Teepa and your host, Greg Phelps.
Hello and welcome to the Dementia Care Partners podcast. My name is Greg Phelps, and joining me as usual is Teepa and from an online article. Alzheimer's disease is the most common form of dementia. About a third of people over 85 show signs of this disease. The genes from your parents play a part at this age, but so do things like diet, exercise, your social life, and illness. Dementia is not a normal part of getting older. Do you agree or disagree with the part I just read?
I agree that dementia is not a part of getting older. I do not agree that for sure Alzheimer's is the most common type. I think it's simplifying it past legitimate words. I think what happens is, especially for people over the age of, what was the age, Greg, 65 or 70, or what did they just
85.
85. Oh, 85. Well, I have another article, not that one, another article that said they looked at all the brains of the people who supposedly had Alzheimer's over the age of 80. And what they found out is that 40% of them actually didn't have Alzheimer's. They had TDP43 latent. And it's this latent condition where what happens is it's a different protein. It's a malformed protein. It's TDP43, which is a different protein than the beta amyloid and the tau, the straight tau. So when you look more carefully, it's like actually 40% of the people, of the brains they looked at, these were several, I mean, this was one study, but there were several of them that found old people might have a different dementia going on. Now, it's similar, but it is different. It hits the brain differently, and it involves more FTD type symptoms. So that's where it's like, I'm having trouble with this. And it's not just the genetics, it's life experience, it's exposure to environment. But I think we have to be super careful about this idea of, oh yeah, it's Alzheimer's, so if we could fix it, then all this would, we'd be great. And it's like, I think you've done pretty well to get to 85. I don't know. You ask me, it's a pretty good deal if you made it to 85 and you were functioning fairly independently up to 85. Maybe some physical health things. Well, then we've got to look at, I think, vascularly, most people, or respiratorily, most people are a little more compromised at 85 than they were at 65. It's 20 years. And they were a little different than when they were 45, and they were different when they were 25. The idea that you wouldn't continue to change over time. I'm always curious about the tools that they use to determine dementia, because it gets tricky. I mean, that's the other thing that gets a little bit tricky. The social definition is I can't live my life as I've lived it, because of cognitive reasons. I cannot function as I used to. And that's a dementia. I'm not sure that I buy the idea that, that Alzheimer's is the be all and end all of it. I think that's too risky, because I think we need to really pay attention to symptoms in care, at least. In cure, they should get really curious about that.
So I know it changes, but how many types of dementia have we identified more or less so far? Because so many of them cross like this. Yes, you've got this, but you've also got this. So
yeah, it gets so super weird, because like if you have MS, you can get a dementia associated with your MS, and your multiple sclerosis is the abnormal, like the outside of your nerves have issues. So you have a dementia that's developing from that. But if we look, you might also be developing some abnormal protein formations in the system that some of them look like Alzheimer's, some look like vascular, some of them look like, FTD-ish. So what do you have? I mean, do we just call it, you have multiple sclerosis with or lupus, or a lot of the autoimmune disease? So if we consider all the possibilities and variations, you have pediatric ones. We're looking at well over 100 and probably well over 200 variations on the theme. So, I mean, I think where we have cancers, where we're now starting to pick all that apart and look at the coding, we're starting to go, ooh, wow, okay. If you have this and that, but not this, this would be the treatment for you. I mean, and cancer is getting to that place. We're we're nowhere near that when it comes to dementia.
Because of treatment and science and things like that, now there are some cancers that are sort of okay to have because we
Yeah.
figured out how to deal with them.
Well, if you
I
catch
don't
them
think
early, you
we're
got to catch them early. But if you
yeah,
do catch them early, boy, can you make a difference in longevity, but also quality of life. And some of them we don't.
but
We
so
don't have.
far we haven't done that with dementia. We haven't got a miracle drug that steps in and cures this particular kind.
Yeah, but I think one of the problems is we don't talk about dementia like we talk about cancer. We talk about Alzheimer's disease. And if we do that and we just focus on that one condition, and it's not one, it's actually probably about 7 to 8 at least, and maybe more that they're discovering. Alzheimer's isn't all in one bucket, it's complicated. Then we're missing other people, and we're particularly missing people if it's vascular. Wow, we could do things right now. I mean, right now, and they aren't high tech things that truly could, if people decided they really wanted to reduce their risk, could really make a huge difference. But you got to decide to stick with it. It doesn't work to just do it for a week and, okay, now I'm back on track, right? It's not like a surgical procedure where you're going to heal from it. Cha-ching, I'm back how I was. There's consequences to not staying on the diet or staying in the exercise lane or whatever it is.
Deepa, thank you very much. Now, I'm going to tell people to go to your website in just a moment, but sometimes that's like jumping into the ocean too. By all means, go there and have a
Oh,
look around.
yeah,
But can I also, make an appointment to talk to somebody and get a little more specific? Because it's a big thing to
absolutely.
jump
It's
into.
absolutely. And we do a 30-minute complimentary consult for anybody who comes to our website and says, "Hey, I would like to talk to somebody. I'm this and I would like that." And we'll help you figure it out because we get it that it's a lot. And especially when you're sort of overwhelmed because potentially you have things going on in your world or you're curious, come and talk to us. That's what we're here for.
Deepa, thank you very much.
Thank you, Greg.
You've been listening to the Dementia Care Partners podcast. For more information on today's podcast or any other dementia related topics, go to teepasnow.com.